All right, Kylie, thank you. Well, the Bureau of Labor Statistics estimates the U.S. will need to hire more than 2 million new healthcare workers by 2026, including 1 million nurses. Carmel-based Orbis Education partners with colleges and universities, healthcare systems to help meet healthcare staffing demand. Founder Dan Briggs and Chief Product Officer Scott McCormick are here now to explain how the model works in this week's Eye on Education segment. And gentlemen, welcome to the program.
Thank you for having us, Gary.
Dan, I'll start with you. The company incorporated in 2003 and really got going commercially in 2010. Talk about the whole idea behind Orbis Education.
Sure. I've spent the majority of my career in healthcare, and what we were really looking at is this continual shortage of healthcare employees. And really at the inception, we looked at nursing. At that time, the shortage was 800,000. So over 10 years, even though we've been in business, the shortage keeps getting worse. It's really a breakage in supply and demand. The healthcare systems are needing more because we're aging as a population. In addition, the amount of nurses themselves are aging with us. Secondly, people are living longer. And as they live longer, they need more healthcare employees. So we're trying to figure out how do we help schools expand that reach.
So schools, healthcare systems, those are some of your big clients. Scott, talk about how the model works, how operationally Orbis works.
Well, we built the organization on quality. We assumed that quality would be the center of our operation, so that we built all process around that. If we produce a quality product for our universities, we work with them to really provide services that they don't internally have to help educate more students. So those services being marketing, recruiting, helping them put their curriculum into an online or a hybrid format, helping them find clinical placements in the healthcare world.
So is it to provide a delivery system for the organizations, or what specifically do you provide to them?
Specifically, we'll actually do student marketing. We will do the student recruiting. We have an instructional design and e-learning team that will work with their faculty one-on-one to help provide the online environment that students will interact and learn about healthcare education.
And go a little deeper. I mentioned those numbers off the top, but those are staggering numbers. That's a good thing for your business. I mean, you've got a lot of demand out there. As we were talking off camera, you talked about the unique aspect or element of your business where you're really helping to fill a void, right?
Yeah, so one of the things we do is we really focus on the healthcare systems, and we talk to them about where are their needs, not just today, where are they going. So one of the things we've done is hospitals, health systems, clinics, all need these people to be in there working on a day-to-day. What we do is we really talk to them and say, okay, how can we change this model a little bit? So with Scott's team, what they've really done is we've removed the classroom. So it's very traditional in a standpoint. Our students still have to spend a lot of time with patients. The hospitals, the healthcare systems, they have those patients sitting there. What we also have done is expand those hours. So we're no longer talking about everything has to be done in that 8 to 5 period of time. We can go evenings, we can go weekends, because hospitals are 24/7 operations. So what we've done is expanded the capacity of training these individuals or educating them in a hospital system, as well as now we've given the student the ability to say, I can now accelerate this because most of our programs are only 14 months long. So we're taking 2 years of college and condensing it. So it really allows more people access.
And a good example, you partner with universities and systems around the country, but Marian University here in Indianapolis and I think St. V's. Talk about how that partnership works.
Sure, so that partnership is one of our older ones. We actually started that partnership at the end of 2009. The way that partnership works is all of our students are being educated at Marian University. They're doing their theory work in an online component that Scott's team has developed. They do all of their clinical practicum and all of their clinical experiences done at St. Vincent's. At the time, what we've worked with is both Marian and St. Vincent's to create a very unique partnership, which is called Marian University for St. Vincent Health. That partnership has produced in excess of 1,000 new nurses for them over the last 10 years.
Very quickly, we want to talk, you're a success story, this company. Talk about the number of jobs that you have grown. You've become a substantial company.
Yeah, so you're looking at when we started the company, Scott sitting to my right was employee number 1. We now have over 300 employees. We've just expanded our corporate office in Carmel. So we've also increased that. And the goal here is to continue to grow the organization because as you look at those numbers, there's no end in sight.
Yep, very good. Orbis Education continues to grow, and Dan Briggs is the founder of the company, Scott McCormick, Chief Product Officer as well. Thank you both for being on the show.
Thank you.
All right.